That's 99 lifted.
They fly in some of the UK's most dramatic landscapes.
Okay, the weather's starting to close in. I'm worried I can't get over the ridge. My escape option at the moment is to go up.
From high-rise city centres
It's going to be bumpy, it's going to be turbulent, guys.
to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, Evan?
The crews of Yorkshire's 2 air ambulances risk their lives
Gone unresponsive.
It's just gone unresponsive on us.
to save yours.
There's potentially fatalities involved.
That car's a right mess.
Delivering intensive care by air.
It's not safe.
There's a lot of blood there. There's a lot of blood there.
No matter how critical the case,
This is the first time anything like this has ever happened.
We're circling a house fire.
however risky the place,
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee. You're having a heart attack, okay? The heart is blocked. Let's get loaded and go.
going to extraordinary lengths,
Hey, this from Medic 2 at the patient's side, however.
with humour
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
and compassion.
Okay, Chick, we're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
So I think he has dropped straight down there then.
In the Dales, a cyclist is seriously injured when a crash catapults him over the side of a bridge.
I'm grunting. Why are you grunting?
Because my legs hurt.
We're going to need at least 2 ambulances, aren't we, I think?
A couple and their dogs are involved in a crash off a busy motorway.
They've just rolled straight off. It's rolled about 8 times.
And high on a hillside, Dr. Neil faces a tricky ankle fracture after a woman's dog walk goes wrong.
You keep going on that endonoxetine, you're doing really well.
At the Yorkshire Air Ambulance HQ, the scramble siren is sounding. The crew of Helimed 99 are being called to the Dales. A cyclist has fallen over the side of a bridge.
Engines go to flight. Confirm both flight and guarded. Confirm. Risers down. Okay, over the blue line 101. He's a piece of good tail coming round.
On board today are paramedics Sammy and Al, and Dr. Steve.
So we get called to see a lot of cyclists, especially out in the Dales, a beautiful place to ride your bike. Unfortunately, as a cyclist, you're relatively unprotected from the road and other road users. You may have a helmet on, but often wearing fairly lightweight clothing, lycra, that sort of thing. So the injuries sustained can be significant.
So for Reef, I think it'll be obviously James Cook and Darlington probably.
We've had reports that a cyclist, I believe a road cyclist, has come off his bike and fallen over a bridge, and on landing has broken his leg. We're unsure as to the actual severity of this injury. There may be more injuries that weren't initially appreciated on the call.
Pilot Elaine is racing her team to the heart of rugged Swaledale.
So 2 minutes to run. Yeah. And looking at it, if it's a bridge, it is literally going to be where the stream is, isn't it? I'll do an orbit and see what we've got. Okay.
It looks like where that white thing is on the nose.
They're straight on the nose.
Literally on the nose.
We might have to find somewhere flat by the stream.
Pilot Elaine will rely on 20 years of flying experience to safely land the helicopter in this hilly terrain.
Can you see that little sort of scar above that dark brown bit on the far side of the stream? That looks big and flat enough, doesn't it?
Alright, mate, I'll give that a go.
Head desk from 9-9. Official is seen. Final approach. Over. All looks good left.
Got this bank on this side.
Just come right one, Elaine.
Yeah, mate.
Looking good. Eyes on the tail.
Cheers, guys.
The local mountain rescue team have been tending to the patient.
I've just been down with him. Yeah. I've cut his boot. It looks like he's got a tib and fib. Okay. He's got cap V filled, sensation, and I've got a pulse in his foot. Lovely.
The cyclist was catapulted over the side of the bridge. It's a 15-foot drop.
Getting on his bike towards the middle of the road.
So I think he has dropped straight down there then. I was wondering if the bike could come down the hill a bit, but wow.
Hello, buddy. My name's Al. This is Steve. How are we doing?
Good. I'm in a lot of pain.
Okay. So you've come off the bridge, have you?
Come off the bridge, my leg is snapped.
24-year-old local pub chef Cameron Durdy landed on the rocky stream bed below.
I'm just going to have a quick look at your top end while Steve starts to look at your leg, okay?
Behind you a minute, Cameron.
Okay. Okay, so just, first of all, I just want to check your neck. I'm just going to press on and I want to know if it hurts. We're all right there?
Yeah.
Yeah? Okay. I'll go down a bit more. And this is all okay down here?
Yeah.
You're grunting. Why are you grunting?
Because my legs hurt.
Get some IV access,
Yeah.
some stuff, and we'll get that sorted. This chap had unfortunately come off on a corner where a river went underneath a bridge, and he'd gone over the parapet of the bridge down onto the riverbank, fortunately not into the mainstream of the river, but landing very close by. Up in the Dales you get these steep-sided valleys and rocky riverbeds, and as we were overhead the scene we could see this was going to be quite a difficult job. I'm not allergic to anything that we know about. Wasps. Wasps. Okay, I'll put them away.
Cameron's leg fracture is serious. The bones have pierced his skin. Without swift intervention, paramedic Al knows there's a danger he could lose his foot.
Analgesia-wise, Al, start with morphine or should we just go
I'll give him some ketamine because that's
straight
going to
in for the
work.
K? Yeah.
We'll pop that down there.
You'll need to out of chain.
Alright.
That my right arm is holding my.
I know, so I'm
leg
going
up,
to...
so
You keep it holding it and I'll wrap this round, okay? So it might seem like we're not doing the right lot, but that's because before we start asking about
whatever you've got to do, man, just
Well,
do your
before we
thing.
start asking about your leg too much, we want to get this painkiller on board, and then once you're feeling a bit more comfortable, we'll do some more stuff to your leg.
Cameron was lying where he fell for some time before passers-by found him.
My husband and I were coming to walk our dog, and we essentially came over the bridge and noticed that the gentleman was down here. To be fair, I'm fairly surprised he's conscious and fairly happy with it, to be honest. Didn't lose consciousness and didn't hit his head on any of the rocks, which the brook's quite low at the moment, so it's a surprise.
I quite like the sound of a babbling brook. Do you? I think if I was going to have an accident, I'd quite like to be beside
This has been my painkiller so far.
Yeah, it's quite nice, isn't
I
it?
feel like my pain is just going down the river a little bit.
It's calming.
Nice way of looking at it.
Need a bit of that.
Pop that on there. There we go.
Cameron's leg will need to be straightened where he lies. Dr. Steve is giving him ketamine. It's the strongest drug the team carry, and it can cause hallucinations.
Right, are we ready for a journey? Have we got splintage and stuff?
Yeah, Sammy's just behind you, I think.
Super. Okay, we're going to start gifting this in. Okay, Cameron. Now, like any visit to the bar,
Let's take it.
we're going to go one round at a time. Okay, I'm not expecting you to buy any rounds tonight. We'll start a little bit. Okay, the beauty with a little bit is we can always give a little bit more. But we'll see if we can hit that sweet spot where you don't care as much. Okay, and the pain goes away. Now, ketamine can be a bit dissociative, it can make you feel a bit spacey. I want you to focus on the fact that we're here to keep you safe. So think happy thoughts. Okay.
I think that's starting to do something.
Yeah, it's doing something, isn't it? Yeah.
Whoa.
Okay. It's good, isn't it?
That was quick.
Yeah.
Once Cameron is fully dosed up, the team will straighten his leg.
Are you ready for your next drink yet, sir?
Yeah, go on. Maybe just a half. Yeah.
Just a half, you reckon? Okay, buddy?
You alright?
I'm good. How are you?
If it weren't for that, I'd be in a lot of pain, I think.
Yeah, is the pain sort of eased off a bit now?
Yeah.
Ebbed away, just flowed away with the river, yeah?
I don't even need my leg anymore, man.
Cool.
Oh, that's not what it's supposed to look like.
No.
What's that?
It's a alternative anatomical arrangement at the moment. Got another half?
Yes, please.
Okay. Ketamine is a very strong drug that we use. It's got pain-killing properties and sedative properties. In this instance, we used it for both of those, so the patient kind of forgot what we were doing to him when it was painful, but had some pain relief. Ketamine, though, has some interesting side effects, as we found out in this case.
So in a minute, I'll give you a hand. We're just going to support his leg from underneath as much as we can so it doesn't move about very much.
Yep.
And then while you're doing that, I'll take the boot off. And then once the dressing's on, we'll just slide the splint in underneath and try and straighten the leg out a little bit.
Bit of a spot there, Cameron. Yeah, sweet. Okay, let's get this sorted out.
Ketamine is fast-acting and short-lived. The team must work quickly.
Close your eyes.
Yep, you
Put
ready?
yourself in your happy place.
Yep, no
okay, it'll be over in 20 seconds. and you'll be in a better place just then, okay?
Okay, you ready? We're just going to have a little pull.
That's it, straight leg there, Cameron.
Okay.
Let the guys take the strain. You can relax your arm. Okay.
One more.
That's fine.
They're using traction to pull Cameron's leg back into alignment.
Ow, I'm in pain.
Okay, you can have some more medicine. Good. Right, it's a bit more leg shaped. That's what we're aiming for, isn't it?
That is more leg shaped, yes. Good. Okay, thank you guys.
That's alright.
Cameron's leg is being wrapped in a vacuum splint, ready for transportation to hospital.
Can you feel that?
Ow.
Yeah, okay. Wiggle your toes for me.
Okay.
Alright, now what we want you to do now is get onto this stretcher.
Okay, you can grab my arm if you want to. That's it, buddy. Bit of a support of her. Yeah, put that leg down straight and we'll put the other one next to it.
Thank you for your help.
Oh, you're welcome. There's not many places we'd sooner be, to be fair.
No.
Inside a nice little brook in Swaledale.
With ketamine, it's all about setting the scene, I think, and everyone does it in a different way. But often, as long as you tell the patient what they're about to experience so they understand it, continue to maintain verbal contact so they are touching base with some reality, and keep talking to them and reassuring them. As with Cameron, it can be actually quite a smooth and not unpleasant experience.
After his 15-foot fall, Cameron may well have other hidden injuries.
Hands up. Yeah. On three then. 1, 2, 3.
The mountain rescue team will carry him up the steep slope to the waiting helicopter.
Well, it's a nice bike as well.
It's an e-bike, yeah. She could have been going at a fair lick.
Yeah.
A little bit of scuffing there, but...
Yeah.
Everyone ready? On lift. 1, 2, 3. Lift.
Keep going. Keep going, that'll do.
Cameron will be flown to the major trauma centre at the James Cook Hospital in Middlesbrough.
Are you ready for a little top up?
Yes, please. Yes, please. I'm starting to really feel like I'm in a lot of pain.
Okay, that's no problem at all. You can ride that all the way.
Engines both to flight. November flying gate. Confirm both. Doors harnesses stretcher. Close secure.
We're all good in the back.
And closed and secure in the front.
It's 34 miles to the hospital and just a 13-minute journey by air.
H145, we've got 6 on board, just lifted from Swaledale and routed to James Cook.
How much ketamine have you given me, Steve? 100. You going to give any more?
No, I think we're okay.
With plenty of painkillers on board, Cameron is now comfortable. Much more comfortable. It's not often the medical team is serenaded.
Almost like a monastic chanting, isn't it? Beautiful.
Are you looking at his book?
He's singing to us.
Oh, is he?
That's probably it.
As long as he's comfortable.
So this was a first for me. I've never had a patient serenade me on the way to hospital. He was clearly a very musical chap, and as he was coming out of the ketamine sedation, he felt disinhibited and tuneful. So serenaded me all the way to the hospital. Wasn't sure about his musical choice. Come Fly With Me would have been good.
After an entertaining flight, pilot Elaine prepares to touch down at James Cook Hospital.
Good on your side? Yep, you're still good. You're clear with the light stanchion at this angle. Let's come forward a little bit. Roger.
This journey would have taken an hour by road.
Adask from 99, landed, James Cook.
Thank you guys for looking after me.
No worries, Cameron. Welcome to Middlesbrough.
Yeah.
Cameron may be in full voice, but he's been lucky to survive a 15-foot fall, and his injuries are serious. He will need surgery and will be months in recovery. $300,000 cars travel on the M1 motorway each day, and the air ambulance team cover a 47-mile stretch of it.
Guys, I might have a job for you.
Dispatcher Matty's on the line to first responders. It's a motorway crash so bad, backup is needed urgently.
I believe there's 2 patients trapped in this car that's rolled on motorway. There's a DCA with a similar ETA to you and they've allocated hearters all over.
Dr. Neil is straight to it. Pilot Elaine will be flying him 10 miles north.
100, 101, piece of good.
We've been tasked to an RTCA road traffic collision on the M1 for a vehicle that's been reported to have been involved in an incident and has been described as a rollover, so the vehicle's physically rolled itself over on the carriageway. There's no crew or scene update at the moment, so we're not entirely sure the nature of the injuries. At high speed on a motorway between sort of 60, 70 miles an hour, you can have significant life-threatening injuries.
Paramedic Andy is helping navigate to their location.
We're probably about 1 minute away. So it's south of junction 47, and we're talking north of Garforth. That sort of south area.
Yeah, affirmative, north of Garforth.
Yeah, we'll have his eyes skinned, mate. The traffic is still moving in both directions with what we can see from here.
Roger, there's another note just come in now. Fire on scene. Between junction 48 and 47 southbound.
Yeah, roger, mate. We've got visual of scene. We've got the fire appliances. That car's a right mess.
We could see that the vehicle had come off the motorway through the barrier and down the embankment on the side of the motorway and had then rolled into a field. Lots of damage to the vehicle, lots of debris lying around.
The car has come off the southbound carriageway. It's not clear how many casualties are involved.
Is that close enough or do you need to get closer?
Up to you, mate, whatever you think's. Without disturbing the scene, I think that's probably good there, mate.
Are they in or out of the car?
I think there's one in and there's one out.
I think, yeah. As we approach the scene, I can see there's 2 elderly patients who are occupants of the vehicle. One sat still inside the vehicle and one sat on the ground next to the vehicle, being attended to by the ambulance crew that arrived before us.
They've just rolled straight off. It's rolled about 8 times.
Yeah.
So
we're going to need at least 2 ambulances, aren't we, I think?
And in this unfortunate case, we can see that there were a number of dead dogs and a number of injured dogs still moving around on the scene, and the fire and the police service were trying to manage those animals.
Can you remember what's happened? Have you been unconscious?
I don't think I've been unconscious.
Not while we've been here, I've been
unconscious. There's been coherently talking, communicating.
Conversation.
I'm just going to have a look at your chest, sorry.
73-year-old Dave King has no idea how his car came off the road. Andy isn't taking any risks. Although Dave's awake and talking, he's likely suffered significant injuries.
Any pain in and around your pelvis and groin?
No.
Any pain in the back of your neck?
No, nothing.
No.
Dave and his wife Jennifer were on their way home from a holiday with their 5 spaniels. All the dogs were thrown from the car in the impact. Only 3 are still alive. The fire brigade are doing what they can for them.
Are they your dogs, are they?
They're all rescues.
Are they? Oh, bless them.
So this is a really sad job. I think as the medical team, we have to make sure our focus stays on treating the driver and the passenger of the vehicle. We're not in a position to treat the animals. We don't have any training to treat the animals. Fortunately, we've got the other emergency services and we all work together as a team.
Ready, steady.
Oh, that's just because I'm 73.
Don't worry.
You don't look it.
You've been very lucky.
We'll come back down when we get over there.
We're just going to walk him to your vehicle. Are you in first vehicle? Yeah, nice.
Obviously, if I'm going up there,
yeah,
I'm not going to see my wife, am I?
No, but that's fine. We're looking after her. She's sat up and talking as well. All right, and we'll get messages between you, but at the moment we just need to make sure that medically you're okay. All right, Dave.
In the wreckage of their car, Dave's wife Jennifer is being checked over by local paramedics. It looks like she has a head injury. Dave is disorientated.
Where were you heading?
Manchester.
Okay.
Right, okay.
Is this me that's come down here?
Yeah, it is, yeah.
Okay.
Yeah, try not to think about that.
As well as physical injuries, serious accidents can also be psychologically traumatizing for the victims.
I've got 2 dead dogs, and one who's on his way out. The other one's bloody 15 and he's survived.
You clearly love them, and they're better off for having been with you as well anyway, yeah?
Oh no. The last thing I can remember is watching the speedo and sitting in
setting the cruise control.
Okay.
That's all last time.
Right. Can you remember rolling or?
No.
Right, okay, so possibly a brief.
Being driving and being...
And being in field, you can't remember.
I can remember being upside down in the trench.
Right.
And then it going, rolling upright.
Yep. Oh, so you can remember the actual roll?
From
what, a point of it?
In the suitcase in the back seat.
Yeah, we'll have a look round.
Amazingly, his wife Jennifer is also able to walk out of the car into the waiting ambulance, but she's had a bang to the head and is clearly shaken.
So the vehicle to our right has come off the motorway, the M1 southbound, I think, and rolled down a grass bank through a ditch to land on its wheels the right way up. Significant speed, possibly, so the potential for injury is really high. But modern vehicles with airbags and the fact that they've rolled down a grass bank into a soft field has possibly saved their lives in the context of what's actually happened. So both the patients in the vehicle are what we would describe as walking wounded. So they've got some minor injuries, they need to go to hospital for a check.
Do me a favour, Dave. Take my hands, pull me towards you, push me away.
Paramedic Andy's carrying out neurological tests.
Kick your leg forward. Oh, other one. That's it. Pop it down, kick your leg forward. Nice one. You sit yourself on there, lovey. Alright.
Thanks
Yeah.
for visiting you, Doc.
Bad day. I wish it.
Next time I see you.
Yeah. I wish you well. Alright, for a speedy recovery, especially the hand. Alright, but it's, yeah, just one of those days.
Dave and Jennifer have been lucky to escape with their lives, but paramedic Andy has serious concerns.
She's got some pain across her chest, but it seems like bruising. But I always worry with people of that age, they're always going to fracture the sternum, aren't
The full extent of the couple's injuries will be determined in hospital, and it's not yet known if the surviving dogs will make it.
Yorkshire Ambulance Hospital Air Desk.
On the air desk, paramedic Lisa is just beginning the late shift,
Do we have a name for that passerby?
and an ambulance controller on the line. A car has crashed on the M1 motorway.
So this job, somebody's on the motorway, they've seen someone in a vehicle, just missed their car, they think they were unconscious at the wheel and have gone down the embankment.
100, just over the blue line, T's a piece of good, miles clear.
The Nostell crew are on their way. On Lisa's team today are paramedic Al and Dr. Paul.
We're just going to a car that appears to have come off the motorway. It's actually come in from a driver on the motorway that's phoned the police, and the car's just swerved straight in front of him and then shot off the side of the motorway, and he seems to think that the driver of the car was unconscious prior to actually coming off the motorway. The particular concerns for high-speed impacts are internal injuries, so things that we can't see. So that may be significant injuries to the chest and to the lungs, to the abdominal cavity causing bleeding, or to the pelvis itself with significant fractures.
Doncaster, good afternoon, this is Telemed 98 Alpha. 8145 out of Nostell, been tasked to a job near Hart Hill, Sheffield area, 5 on board, looking for basic service, please.
Pilot Elaine is flying the team 22 miles to a section of the motorway south of Sheffield.
It's right near Woodall Services.
That's it, yeah.
Yeah, Woodall's quite a long way south. Yeah, it's right on the border with EMAS.
It means the team are now flying a long way from emergencies in their own patch.
My eyes are in a minute.
I'm looking out.
In just 9 minutes, they're over their location. 500 feet below, police have closed the road around the wreckage of the car, which has come to a rest on a parallel minor road.
I'll try and get it on the road, but I'll go from the other side, so I'm not going to cause a problem so much. Right, I need you to clear of obstacles on both sides.
I'll keep an eye behind and road and tail. Yeah, about there's good now, Elaine. You'd be good on the left here, yeah. And you're good behind?
Good on the right? Good right. Good right.
Just straight down now, I think it'll be fine.
Just be careful when you're getting out, guys. Yeah. Just straight ahead, yeah? Yeah.
27,000 people die or are seriously injured on Britain's roads every year, and this driver has had no medical attention.
I'll let you have a chat with you if that's alright.
Yeah.
To the medical team's surprise, He is conscious and talking.
What's the plan then? What's been happening?
I'm on my way home.
77-year-old Joe Hillam is making light of the situation, but he slewed off the motorway and bounced 100 yards over 2 embankments before finally coming to a stop.
And do you remember leaving and coming down here?
I remember closing my eyes.
Right. Oh, crikey.
This man had been through a huge ordeal with the high-speed road traffic collision that he'd been involved with. He was laughing and joking, but my concern was that actually he seemed like a fairly stoical Yorkshireman, and therefore my concerns were that actually he had some more significant underlying injuries that we hadn't found by that point.
No pain anywhere?
No, nothing, I'm fine.
Were you wearing your seatbelt?
Yes, oh yes.
Right, okay.
Might be a bit tight at the moment.
Yeah.
His heart rate is 130 as it says on the monitor.
Right.
Radial, let's go with that, I think.
No other vehicles were involved in the crash. Lisa and Paul are concerned there may be medical reasons behind the loss of control.
No problems with your breathing?
No, none at all.
You don't feel short of breath at all?
No, I feel fine.
I'm just going to go up your top.
Right.
Excuse me. You just take some nice deep breaths.
Joe's heart is racing.
I'm just recovering from COVID.
From what, COVID?
Yeah.
Ah, yeah, right. Right, young man, your oxygen levels are a little bit low. Well, they're quite a bit low. Have they? Okay. How long ago did you have COVID?
Last week.
Last week?
Our trip out came out last week.
You came out last week, right. Because your oxygen levels are lower than what's normal for you,
right,
and your heart rate's a bit fast, I think you should go get a check over at hospital.
Right, but not today, surely.
Lisa is at a loss to know why Joe is resisting a hospital check.
So he's saying his oxygen levels are normally low, but they're normally about 94. Recovering from COVID, he's just come out of isolation last week,
right,
so that's probably got something to do with that.
Heart rate.
But his heart rate, I said he should go to hospital, but he don't want to go.
No, I'm not going to hospital.
I think you should.
I've really had enough and I'm not going.
I know.
Definitely not. I'm going home. That's the thing, my next point is home. My home. I just want to be in my home.
Yeah. What about if you just went to hospital for a quick checkup?
No, I'm going home.
And what if you get poorly at home and there's nobody to help you?
Well, at least I'm going to die happy in my own home.
So unfortunately we're still seeing some of the long-term effects of COVID, and for some people who have been admitted to hospital through that time, they've had some truly horrific experiences, and I think for a lot of people they never want to go back to the hospital experience, which is entirely understandable.
I'm sorry, I've seen enough of hospitals. I'm going home. I was on that corridor watching people there, and then nobody was taking any notice. I mean, on a corridor, 14 and a half hours in a chair, and we were actually watching people die. They were letting them die. There weren't even anybody saying hello to anybody or watching them. Well,
that might just have been a really bad day that they were having.
Dr. Paul is hoping a phone call to Joe's stepdaughter will persuade him to be checked over in hospital.
Sounds like he's had a pretty grim time in hospital recently from what he's telling me. And he's fairly adamant that he's not going to hospital. Even though he's talking kind of entirely sensibly, and I absolutely get what he's talking about, and it sounds like his time in hospital was pretty horrific. It's the first time I've met him, and for somebody to have that heart rate, his blood sugar levels are really high and his oxygen's pretty low. I'd be very, very reluctant to let him go home, or even to be able to say that he's kind of weighing everything up, properly. I almost think it's one of those where I completely understand that he really doesn't want to go to hospital, but at the same time, he really does need to go for a checkup. I don't know if you want to have a chat with him or not, but that's kind of where we are at the moment. There you go, it's Beth.
Right.
Have a chat with her.
Yeah. Hello, Beth. Yes, sort of. I'm not going. I've told them I'm coming home.
The team have a duty of care to their patients, and Joe's reluctance is putting them in a difficult position.
I just don't know we're going to make him go.
Well, neither do I, and that's what I was trying to say to Beth, and we'll try the softly approach, but at the same time, I just don't think medical legally he can go.
What did your daughter say?
You do what you want, Dad. You know your own man. Yeah, she knows I won't go.
Right. How old are you?
77.
Right, the thing is, age and speed don't go together very well.
Don't they?
You've come across all this.
Yeah, I know.
Your car's not looking right, cracking on back of it.
Well, no, but I mean...
And you were in it.
Yeah, well, but I'm fine.
I'm going to spin it on its head, okay? So you may or may not be fine when you go home. You probably will be. But all I can do is I can ring the hospital up now, whichever one you go into, and I'll check with these guys to tell them you're coming down and ask if they'll have a look at you when you get there.
Immediately.
That's the best I can do, is to give them a call now.
If you don't do it immediately, I'll just get to
I know,
walk out.
and I'm not trying to be a pain in the arse. I'm trying to just be straight with you, okay?
If I aren't in
Yep.
and out of the hospital within an hour,
yep,
I will get up and walk out.
Yeah. Right, let me get on the phone and give them a ring. Let me find out where we're off to.
Have you got anything else valuable in your car?
At last, Joe has agreed to go by road to Sheffield's Northern General Hospital for the checkup he needs.
I'm going to ring the hospital, okay, so they know you're coming. We don't want to force people to do anything, but I'm not entirely convinced this gentleman fully remembers what happened today. And we have something called capacity, so we have to judge whether people can make decisions for themselves. And I'm not completely convinced he's absolutely understanding the risks and the benefits of him not going to hospital. So we've not had to force him to do anything, but he has kind of reluctantly agreed that he'll go to the hospital to get checked out, so we can have a real good look at him. So I'll leave him with these two chaps. Nice to meet you, buddy. See you later, Joe. Yeah, see you later, Joe.
It just breaks your heart, really, when you think of people that are lonely, that are isolated, that have got through these COVID times all by themselves, have had to go into hospital and witness these sights. It's just so distressing for them and so upsetting for us as healthcare providers. You know, we all try our best, we're under extreme pressure, and despite all that, we want to deliver the best patient care that we can.
Joe is heading for comprehensive tests in hospital to get to the bottom of why he careered off the motorway, though it's not certain if he'll be seen straight away. At Nostell Air Base, paramedics Pete and Sam are being scrambled to an injured walker.
What's the job? Woman that slipped on a hill, foot pointing the wrong way, on Ilkley Moor somewhere, I think.
Helimed 98 Alpha is adjusting to 1,300 feet.
On board with the team today is Dr. Neil.
We're going to Ilkley Moor for a lady who's reportedly broken her ankle, and there's some suggestion that it's not pointing in the right direction, which suggests that the blood supply could be compromised to her foot, and I imagine it's rather painful, and she's some distance from the road, so we will be able to land relatively close, make an assessment, and if necessary we can give her a strong painkiller, something like ketamine for example, and make her foot straighter and improve the blood supply, which may improve its recovery and healing, and actually the survival of the foot if it's really at an odd angle.
Starting from Ennis. Yeah, I've had this detail upgraded.
By a trauma desk, they've still not got a DCA attached to it. I'll let you know as soon as one is. Over.
Ennis 98, roger, that's all complete there. 3 minutes to run.
In 10 minutes, they are over Yorkshire's famous Ilkley Moor, which is popular with dog walkers and climbers.
Might actually be in trees or scrubland this, which might make it a bit more difficult, because it appears to be a lot more trees on that hillside than there is on the map.
The moor rises sharply 1,300 feet above sea level. Finding a suitable landing spot could be tricky for pilot Harry.
I'm just going to do one pass just to see if there's anywhere, coincidentally, that's flat round there. Visual on the track. She's just in the trees there, the first tree that covers the track after it drops down. She's got a loose dog with her.
We don't get any further left there, or is there rock?
Now what we're worried about is the ground is coming down from the path behind us. Tail is good. Oh, okay. Pete, can you just, I'm just holding a bit of power.
Yep.
Can you just step out for us and just confirm to me that we've not got any rocks or anything penetrating the bottom of the aircraft?
Well done, I'm off the skid.
Thank you.
All looks good, that, Harry.
Cool. Okay, cool. Leave us down.
It's a quarter of a mile down a steep track to the injured woman.
You can understand how someone's lost a footing on here, can't you?
I've been OC and MRT has been requested.
We're coming, we're not far off you. How bad is your pain at the moment?
Relatively bad. It was worse before.
55-year-old Tina Hornby dragged herself into the clearing and called 999 after falling under trees while walking her dog Dexter.
You can start on this. So
Right, okay.
the mouthpiece there, pop
Yeah.
it into your mouth and
Yeah.
take some
Yeah.
nice deep breaths. Okay.
Tina's fractured her ankle badly and it's painful.
Got no pain up at the top
No,
of your leg?
I just felt, because I slipped slightly,
Yeah.
I went, put my foot down, and I just felt it go.
Okay, no problem at all. So I'm going to have to pop a little needle into the back of your hand probably just to give you some pain.
Okay.
Is that okay with you?
The break is so severe, the skin is developing a dusky hue, a sign the blood flow to her foot is compromised.
If we need some sedation, I'll put a green or something in. Yeah. This lady's got a nice vein, hasn't she? So I'll just put something bigger in.
Yeah.
Tell us if
dizzy
it's-
again.
Yeah, that's fine.
That's good, keep sucking
It wears off really quick, so as soon as you start, we'll just stop feeling back.
Bending it down a touch.
With the blood flow to her foot dwindling, there's a danger vital tissues could die. Dr. Neil needs to straighten it where she lies, but it will hurt.
So Tina, I want you to take 10 really big breaths on that Entonox.
Okay.
Okay? Nice, big deep breaths. Keep going, one after the other. You keep going on that Entonox, Tina, you're doing really well.
You've seen it there,
Yeah.
so it's just trying to get your foot back into the position it should be. Okay, if it's too bad pain-wise, you let us know.
Support her knee, turn your hands around, face the other way. Yeah, and I want you to stop me pulling her off the thingy.
So Sam's got to hold your leg, so we've just got something to pull against.
Yeah.
Okay, you keep breathing on that.
Really well, Tina, you keep going.
I feel it coming out to length, so that's good.
Dr. Neil is using traction to pull Tina's ankle back into alignment. It's not easy. The fractured bones are jagged and must align neatly without trapping any nerves or blood vessels.
Oh, hang on.
Yeah, no, I'm stopped now.
On the gas and air, we're going to have another attempt when you're ready.
Yeah.
If we can gently and carefully manipulate it, so you bring the joint back out, because if you fracture it, it becomes shorter, because things go from there to slip. So if we can bring it back out to length and rotate it back into a more normal position, anatomical alignment that we call it, it can reduce the pain, so she's a little bit more comfortable afterwards, but it also helps where the blood vessels may have been squashed and constricted.
So keep breathing.
Dr. Neil has done it, and colour is coming back to Tina's foot.
How does that feel compared to what it was before? Same?
Yeah.
Yeah.
So I can feel a peel now.
Yeah.
Blood is pumping to Tina's foot once again.
You can see it looks a lot better. It's not perfect, it's not quite back into where it should be, alright? But your skin is better.
Yeah,
and your foot's a little bit pinker at the end.
Yeah.
I can't imagine it feels better yet. Though.
Yeah, it does.
Oh, does it feel better now?
It feels a bit better.
And it had gone completely numb, your toes, hadn't it?
Yeah.
Quite cautious over your ankle.
Tina's straightened ankle will be immobilised in a vacuum splint, ready for transportation to hospital.
We're waiting for mountain rescue because we want to get you down safely. We don't want to be tumbling, we don't want to be banging you around and causing any more injury to that ankle.
Tina's worried husband has arrived.
Hello, fella. Alright. So come and say hello, but don't trip over her leg. Alright.
Yeah. My foot was pointed that way before they straightened it. Fell on that steep slope. I was under the trees, they couldn't see me, so I came down here on my bum. He didn't leave my side.
Mountain Rescue are here with a specialist wheeled stretcher to get Tina off the moor.
The stretcher is here, we just want you in the middle, head up this
You're going to be alright.
Do you need some support on your arm?
I think I can.
Okay.
Right.
You alright?
Yeah.
It will be short work for Mountain Rescue to transport Tina to the waiting road ambulance at the bottom of the hill.
Anybody not ready to move? Abby's going to have a downhill. Okay, ready, brace, lift.
The blood flow to her toes was quite compromised, so it was quite poor. And she also had sort of a numb foot. So that could be a combination of blood flow and nerve entrapment as well.
Thanks. Cheers. Have a good flight.
Bye.
Could have used something much stronger like ketamine. And ketamine is a very strong painkiller and it's also a sedative. But we're in the middle of nowhere and sedating somebody is not without risk. So doing things simple is often the better option.
You'll do it bit by bit, yeah?
A&E hospital teams will take over Tina's care.
Really, they?
For the air ambulance crew, their work on the moor is done.
You're grunting, why are you grunting?
Because my legs hurt.
Pub chef Cameron Durdy spent 10 days in hospital after being catapulted over the side of a bridge while cycling home in the Dales.
Thought it was just going to be a nice leisurely cycle on my lunch break, but I lost control at the bottom of Surrender Bridge. When I was in the air, I just remembered like the silence, and then landing felt a bit like waking up in a sort of weird way. I kind of knew that was the biggest thing that had ever happened to me.
He was lucky to escape the 15-foot fall, with just open fractures to both bones in his lower right leg.
They were surprised to find quite a clean break when they x-rayed it. I had a funny thing with the medical students taking my x-rays, and whenever the image came up they all just went like, "Ooh," and I was like, well, you're going to have to get used to this, guys. At every angle they're all pulling faces, but the guy who was going to go on to do my surgery looked at the x-rays and said, well, this is really clean and hopefully should be quite an easy fix.
Surgeons pinned Cameron's fractured bones together, and after demonstrating his talents during the flight, he spent much of his long recovery practicing his music.
I've started going to karate lessons as well, which is, I'm surprised I can get through that. It can be very sore, but that's part of recovery as far as I see it.
It's just rolled straight off, it's rolled about 8 times.
Dave and Jennifer remarkably escaped with just cuts and bruises after their car careered off the motorway and rolled down an embankment. The cause of the crash is unknown.
Any pain anywhere?
Just past me nose.
Of their 3 rescue spaniels that survived the crash, 2 later died, but 12-year-old Charlie is doing well. The couple have since taken on a further 2 rescue dogs.
What's been happening?
I'm closing my eyes.
77-year-old Joe Hillam was checked over in hospital after his car careered off the M1 motorway at 70 miles per hour and bounced over 2 embankments.
No problems with your breathing?
No, none at all.
He returned home the same day. The crash was caused by a tyre blowout.
You keep going on that endonoxetine, you're doing really well.
X-rays in hospital found Tina Hornby had suffered a complex 3-part fracture to her ankle when she fell during a dog walk on Ilkley Moor.
It happened so fast, I slipped with my left foot, and as I went down with my right, that's where I heard the noise. I looked and I could see my ankle was just pointing completely the wrong direction.
Really well, Tina, you keep going.
Tina went into surgery the next day, where her ankle was pinned and plated. She's still on the road to recovery.
The doctor actually said it could be 18 months before I'm walking completely correctly again. And even then, I might not get absolutely the full movement that I had before. I'm determined I'll be back up on that moor and back up on that hill. Nothing will stop me walking in.
Tina's injury was serious. Without a swift rescue and intervention, it could have been much worse.
Thank you very much. Thank you for getting me off that moor. I don't know what I'd have done without them, and for saving my foot as well, because realistically there was no blood supply.
Ready, go.
They did such a fantastic job and they deserve every single penny they get.
Airbus 99 lifted.
They fly in some of the UK's most dramatic landscapes.
Okay, the weather's starting to close in. I'm worried I can't get over the ridge. My escape option at the moment is to go up.
From high-rise city centres...
It's going to be bumpy, it's going to be turbulent, guys.
...to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, over?
The crews of Yorkshire's 2 air ambulances risk their lives
Gone unresponsive.
It's just gone unresponsive on us.
to save yours.
There's potentially fatalities involved.
That car's a right mess.
Delivering intensive care by air.
It's not safe.
There's a lot of blood there. There's a lot of blood there.
No matter how critical the case,
This is the first time anything like this has ever happened.
We're circling a house fire.
however risky the place.
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee. You're having a heart attack, okay? The heart is blocked. Let's get loaded and go.
Going to extraordinary lengths.
Hey, this from Medic 2 at the patient's side, however.
With humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
Okay, chick. We're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
Oh, car versus ambulance.
An emergency care assistant is critically injured in a serious crash with a car.
She doesn't want to put her hips down, does she? Which leads us to think it probably is a pelvis, isn't it?
Paramedic George treats a young cricketer in agony on a village cricket pitch.
Keep breathing, breathing.
Oh, my leg.
You've got into that tree with a fair bump.
And a grandmother is hurt after a car spins off the road and smashes into a tree.
So what was the last thing you remembered? Just spinning round. So is he still trapped in the vehicle at the moment?
At Yorkshire's Air Ambulance HQ, dispatcher Rachel is on the line to 999 control.
Is there likelihood that this patient will be trapped for some time?
We'll do that, rather.
Guys, you've got a job!
There's been a serious crash involving a car and a van. It's outside Yorkshire, but ground paramedics are desperate for backup.
Area? Yeah, it's Bolton. They've got a RTC trapped by Abdo in a vehicle. They've been on scene 20 minutes. Can't get him out at the minute. They want blood and a doctor because he's still trapped.
The air ambulance carries both. It's an immediate scramble for Dr. Sarah, with paramedics Pete and Lisa.
Radio's in live.
There's no change lights on.
Autopilot.
It's engaged.
Auto train.
Engaged. Out round to the west.
Good left.
Pilot Lee is racing his medical team 43 miles across the Pennines and over the county border to Bolton in Greater Manchester.
To the north, follow the M62 and come down to the south on the other side of the peak.
Dr. Sarah's hoping more details will be fed through from the crash site.
We don't know too much at the moment. All we do know is that there's a patient who's been in a road traffic collision. He's been trapped for half an hour by his abdomen, so it seems. And the crew who are on scene are struggling to get him out and have asked us to go to assist with some blood.
My take on this is the crew think because they're pressed up against the steering wheel, when they release them, they're going to have a drop in blood pressure, and that's why they want the blood.
The team are up against the clock. If their patient is close to death, they may need an immediate flight to hospital.
Lisa.
Yeah?
Do you mind just asking, Rach, which trauma centre it will be?
Yeah, hospital.
It might have an impact on where we land, mightn't it? Thinking about it.
Rich, can you do us a favour? Could you just try and confirm
Which is the nearest major trauma centre from this location?
Salford's nearest, that's 7 miles as the crow flies.
There isn't a helipad if we need a secondary transfer, but it's only about 15 minutes by road.
Roger, thanks.
16 minutes after taking off, the team are over the crash site, and what they see is a shock even for them.
That looks like an ambulance there. And it's all, the traffic's stopped.
Right, it's this road now. Visual.
Right.
A road traffic collision involving one of their own is rare, and they need to land quickly. It's not easy.
There's a path, I can get you in this corner, you can probably go through that wood. How do you feel about that? Where does it come out? So it comes out onto the road, you just follow the road down. Okay, we'll take the bags, Lisa. You're going to bring blood, please?
Yeah, you're looking good left.
Thanks, mate. Yeah, we'll go committed there.
Oh, good.
Thank you. The pathway's in the 12 o'clock, guys. Yep.
As they approach, their suspicions are confirmed. It is an ambulance, not a van which has collided with the car.
Oh, car versus ambulance. Oh, is there only one person who has been injured?
The driver was just getting checked out, but he was walking and talking.
Oh, bless, no wonder. Horrifying.
The female ambulance driver appears unhurt, and there were no patients on board. But her colleague, who was trapped in the passenger seat, has just been cut free by fire crews. And she's in agony.
We're not too sure about speed of impact, but we know that she was travelling about 35 miles an hour. Quite a significant intrusion right where she's sat. It's quite a small cab anyway, so I think a lot of damage has gone to the lower leg knees and maybe pushed back into pelvis. She's been quite vocal throughout. She's had decent observations. Anesthesia wise, she's had 10 milligrams of morphine. She's just had another 5 just now, but she's also had 50 of ketamine as well.
Okay. Hello, Eleanor. I'm Sarah. I'm one of the doctors from the air ambulance. Hello. We've come to see you, all right? Can I just have a quick look at you before we move you anymore?
32-year-old Eleanor Whitrod was pinned by her abdomen in the cab of the ambulance for over an hour. She has multiple traumatic injuries.
Yeah, can you stick your tongue out for me? Stick, good girl, well done. Okay, take me a deep breath. Good girl, well done. I'm just having a feel on your tummy, all right?
Her fellow emergency workers have battled to free her, and they know her injuries are potentially life-threatening.
Does that hurt? She's guarding on her tummy, she's sore in her chest. Her pelvis is stable, but I'm not going to be able to tell if it's sore or not. But let's cut the pants and put the binder on, defo. She doesn't want to put her hips down, does she? Which leads us to think it probably is a pelvis, isn't it? Okay.
Eleanor was on shift in a private ambulance when it collided with a car.
They've not been on blue lights, interestingly. I thought they were on blue lights, but they're not. Just driving up here 35 mile an hour, 40 mile an hour road.
Right. Is she one of paramedics?
She's paramedic, yeah. She's front passenger seat. I just think we should go with her.
Eleanor has already been dosed up with disorientating pain-killing drugs. The team are putting her onto a scoop stretcher. She needs to get to a major trauma unit as fast as possible.
We'll start getting on with that, guys.
The question is whether to fly or drive.
Ready? 1, 2, 3.
Lee said he can relocate to the road if you want him to. I don't think we're going to gain out from it.
I don't think we're going to gain. Not for a 15-minute drive. She's had quite a bit of ketamine and morphine. Just have a look at what happened to her seat. I just wonder if her hips are broken. I just was a bit worried because she can't put her legs down, which suggests she's got her hips have pushed through into her pelvis. So having a look at this, she's actually a really small person and it's massive intrusion here. So it's pushed the engine block into where she should be seated. So there wasn't actually enough space for a person and the engine, which is why she's so damaged. See, I'm really concerned about her pelvis, which can bleed quite horrendously. So we just want to be as quick as we can actually and get up to hospital.
Eleanor's medical knowledge means she may be aware just how badly injured she is.
Hi Eleanor, I'm Pete. You've been immobilised because of the accident. We've got you on oxygen, we're monitoring everything, yeah? So, what's hurting now? What is hurting you? Down by your hip? You've got a pelvic binder on. How bad is your pain at the moment? Unbelievable. Some more and I'll do 0.
What's she saying to you about her pain?
Unbelievable.
Oh really? Yeah, let's give her a little bit.
Well done, my lovely.
Where does she say her pain is the worst pain?
Left hip.
It's the hip. I think it's gone backwards looking in the van. Did you see it?
She was in the front of the van. Her legs have curled underneath her.
Yeah,
she can't obviously flatten her legs. So.
No, it sounds like acetabular injury, doesn't it?
Eleanor's in danger of life-threatening internal bleeding.
Good to go.
There's no time to lose. With no helipad at the hospital, it will be quicker to drive. Dr. Sarah and Pete will travel with her.
As a paramedic, you sort of kind of know the pattern of injury that can happen when there's collisions and joint speeds and that kind of thing. So being sat in the passenger seat and being severely injured and in a lot of pain and knowing the drugs that you're given, I would imagine it's pretty scary.
On board the ambulance, it's dusk and the team must battle with rush hour traffic.
you want a dressing or anything over it? Are you happy now?
A dressing wouldn't go amiss.
They are 10 critical minutes away from the hospital. Dr. Sarah is radioing ahead to the waiting trauma team.
A pelvis, although it feels like it's stable, it's got a pelvic binder on, she can't put either of her legs down, and the intrusion into the vehicle makes it look like she's got acetabular fractures. Other treatment-wise, she's had 50 of ketamine, but she's having some more because she's in too much pain.
So the initial increments of ketamine, 20, a further 10 and then 20. And that was some time before we got there.
Pete is loading Eleanor with more drugs, but it's difficult to control her extreme pain and her panic.
Eleanor, you okay? You know you're going to the right place now.
She's been an emergency care assistant for 6 years, but today she's on the receiving end of life-saving care.
I'll be about 5 minutes, Adam. 1 minute.
Yeah.
Do you want some more painkillers, Eleanor?
Eleanor.
She doesn't sound great, does she?
No.
Every jolt on the road is agony for Eleanor, but at last they're at the Salford Royal Hospital.
Well done. Thank you.
You alright?
You're okay.
You're alright, you're not falling, you're not falling, you're not falling.
Eleanor's heading straight for resus. Her condition is critical, and the accident today may change her life.
Pre-takeoff, send you the best flight. Yeah, and the guarded, confirmed left flight guarded.
It's a sunny Saturday afternoon in North Yorkshire.
Doors, harnesses, stretcher. Close and secure, right.
Secure in the back.
Cool, you could left. Roger.
And taking off from the base at RAF Topcliffe, Helimed 98 is airborne to a village cricket pitch.
98's lifted, route in Weatherby.
A young cricketer is injured. Paramedics Daz and Georgina are just 8 minutes flight away.
We've got reports that a 16-year-old may have fractured and or dislocated their ankle. You can actually break it to a point where you can stop the blood supply going to that foot. You can get some nerve damage, you can get some blood flow damage, so it's really important that we get there as quick as we can, just to make sure that we can try and save that limb.
Pilot Harry is flying his medical team 20 miles into scenic Wharfdale.
So just confirm, it's at the cricket pitch, yeah? Yeah, it's at the cricket pitch. They've cleared the field and we can clear to land. So I imagine that one person left on the pitches. Yeah, it's probably the bloke who's hurt himself in the middle of the pitch. Yeah, it might be, yeah. 98's overhead sea, visual, clear to land.
Harry is choosing his landing spot carefully.
I don't want to upset the casualty, but I also don't want to go anywhere near the cricket club itself. No, there's quite tall trees just before as well. I'm looking, I think I'm going to go on... They overshoot and then... Yeah, exactly. The only thing is that the downwash will go slightly towards them, so I'm going to go right off the pitch between the nets and the road. Yeah, roger.
They'll be happy you've not parked on the inner circle, aren't they?
Yep.
They've been playing cricket at Walton Cricket Club for over 100 years. But today, one of their opposing team's youngest members is badly hurt.
Hi, my name's George. I'm paramedic. Brendan is maintaining his own airway.
His mum and an off-duty doctor have been tending to him.
I've not done any cold catch yet. Hi, Brendan. My name's George. I'd like to say what we're doing down here, but I think it's a bit obvious, isn't it? Am I right just do a few checks on you? Is that all right?
Yeah, just make it better.
I will do, don't worry.
15-year-old Brendan is a promising young bowler. He was going in for his second over when his studs caught in the crease and his ankle snapped. He's in a lot of pain.
We're going to give you some gas and air.
Okay.
All right. Pop this in your mouth.
Yeah.
I want you to breathe it in. I want you to take a lovely deep breath in for me. All right, that's it. Forgive me for being presumptuous, are you, Mum?
I am, yeah.
Are you right just to coach him through that? So just get him to breathe. Every breath he breathes in. Have you had this before?
Yeah.
Oh, so you know how good it is then. So as soon as he stops taking it, it will go back to his normal self. But it's just helping his pain at the moment. All right, Mum.
Spasm.
Keep going on this.
Keep going on this. This is right.
It's a severe fracture. His teammates rested his broken leg on a cricket pad until help arrived.
Does it hurt anywhere else apart from this ankle?
Wrist bit here,
on your shin?
The paramedics need to give him painkillers.
Sharp scratch, are you ready? Keep your arm nice and straight for me. Breathe, Brendan, breathe, that's it.
Yeah,
breathe. Breathe. Well done. That looks good.
Daz wants to take a closer look at the ankle, but it's painful.
Keep breathing, breathing. Yeah, we have to get Sue off, and I think looking at it, we might just straighten that.
So we're going to give you some morphine now, okay? I'm just going to give you a bit at a time. So obviously it will help with the pain, but it can make you feel a bit sick.
Yeah, Roger mate, patient update, just ABC stable, query fracture dislocation to his left ankle. Yeah, have you got a DCA en route over?
Yeah, DCA en route from Leeds at the minute does. ETA 17 minutes, we've got it upgraded.
Wait, what's in my hand?
Roger received, 17 minutes over.
The morphine quickly takes effect.
Wait, what's happening in my leg right now? What is it?
It's just spasming, Daddy.
Oh,
So
okay.
this is really good muscle relaxant, okay?
That's right,
so if it's
you
spasming,
need to breathe.
that's it.
What's your weight? 80 kilos?
70.
70.
Probably. It's quite slender.
I'm 80. I'm 86. I'm 86.
You really?
Yeah, I'm
Oh, yeah.
86 years old. I'm really muscly.
Brendan's fracture is so severe, there's a danger the blood supply to his foot may be compromised. The team need to straighten it where he lies, but he's going to need stronger drugs.
We're going to give you a little drug, and it's going to make everything seem like heaven. So this is ketamine, Mum, so it's a bit of a stronger pain relief.
We decided we're going to give him some ketamine. Ketamine's a really good, strong painkiller. Not only does it help that analgesia effect, stop you feeling that pain, but it also creates this sort of dissociative effect where you don't remember what's happened during the event.
Brendan, so you're going to feel a little bit spaced out, yeah?
I'm already feeling a bit spaced
Okay, nice.
out.
Well, it's completely normal. Your mum's still here, and all you need to do is relax if you can.
Tell me about your best holiday.
I've never really been on many holidays, but I remember we used to go to Skegness all the time. It was great.
Tell me about that then.
We're trying to get the patient in a nice relaxed state, give him some pain relief. He's clearly got a dislocation to his ankle. He's in quite a lot of pain when we try and move it, and really what we're going to do is get the shoe off his foot and the sock off so we can have a quick assess of it, and then ideally in one movement get him over and realign the ankle.
Wait for this bit to pass and then we'll...
Once the pain's under control with the ketamine, we'll give that a go.
But the ketamine isn't having the desired effect on Brendan's pain. He's going to need more.
Yeah, so it's 10 milligrams per. Tell me what's going on. What's going on, darling?
What's going on? Oh, my leg.
Listen, deep
Why does that hurt so much? Why am I hurting?
Deep breaths.
I've
Listen.
just woken up on tissue right now.
Listen. Long, slow, deep breaths. Well done. Because he's in pain from his leg, it goes into this dissociative state. So what can happen, because he's still feeling the pain, it brings him back to earth, if that makes sense. So so he's at that border of heaven and hell at the moment. So we just need to give a bit more, just to make him a bit more not quite sure about what's going on. Does that make sense, Mum? Is that all right? Another 10 more, and then we'll I think we just need to get over that border, don't we?
Treating patients of Brendan's age at 15, it's slightly more unusual because they look like an adult, but we still have to treat them as children and give children's doses. It's really important that obviously we don't overdose any children. We're giving them some quite strong analgesia and some quite strong pain relief, and we really need to make sure that it's appropriate for his age and his weight.
The team must now wait. Once the ketamine kicks in, they will roll Brendan onto his back and pull his ankle straight. The ground ambulance has arrived to take Brendan to hospital.
So he's quite a big lad. He's had about 60 milligram of ketamine and morphine.
There we go.
It's time to move Brendan.
There we go. Go.
We're going to roll.
There we go. Well done. I haven't got the strength.
Daz must use force to pull Brendan's foot back into alignment. It's not easy.
Calm. You're breathing down. Well done.
Despite Daz's best efforts, the ankle isn't fully aligned, but it's enough to allow the blood to flow properly again.
George, I'm not managed to straighten it, so it's quite a big lad.
It's got 9 pulses. It's nice and warm.
Right now.
We'll recheck pulses on the ambulance.
A vacuum splint will mould to the limb and keep it immobile for the journey to hospital.
I'm dripping balls. I'm dripping. It's so delayed.
Brendan's had an unusually strong reaction to the drugs. it could be tricky to get into the ambulance.
Brendan,
Yeah.
do you think you can stand up with us and we'll get you on this
No,
trolley?
I don't think I can stand up. My leg really hurts.
I've got your leg, Brendan. Don't worry about this leg. I'll get that. I've got your leg, Brendan.
I'm tripping.
You need to get us done.
I've got your leg. Don't worry about your leg. I've got it.
I can't stand up.
Yeah.
You can't,
Push for your leg.
Cameron.
Push.
Ambulance.
Good lad. Good lad.
Come on, Helen. There you go. There you go. Well done. Yeah.
It's been a harrowing experience for everyone at the club today, but Brendan will soon be on his way to hospital.
I'm tripping balls right now though, sorry! What's going on? Where am I going?
Brendan's mum, Diane, is very concerned.
Just give us a couple of minutes because we're just going to check his blood pressure and things like that, and we'll swing some seats out.
Has he straightened it now?
As much as we can, yeah. But the good thing is he's got a good blood supply to it and he can feel it. So if he didn't have those two things, we'd be more worried. All that. You're going to go in with Toby now. Toby's a much better paramedic than me. Right, take care. I'll leave you in these guys' capable hands, alright?
Yeah.
You seem to have calmed down a bit now, which is good.
I'm tripping. You have it.
Still on his analgesic cloud, Brendan is a 30-minute drive from Harrogate District Hospital. He'll need surgery, and it may be many months before he can get back on the cricket pitch. After a record-breaking heatwave, Yorkshire is being drenched in thunderstorms and downpours.
BMS, Torques, TOTs, N1, NRs 101.
And on the helipad at the Nostell Airbase, Helimed 98 is taking off in less than ideal weather conditions.
480, that's enough for Holland back. Southerly, then left, lifting. Coming right.
In rural East Yorkshire, a car has smashed into a tree. Dr. Paul and paramedics Rachel and Becky are on the case. It could be a bumpy ride.
On the weather radar, it looks like it's just had a pretty heavy lashing where we're going, and there's just many kind of sprouting heavy showers.
Roger that.
We're going to a car that's collided with a tree. Don't have much more information than that. The only thing we've been told so far is that it's an elderly female patient who we think was probably the driver of the car, and they've hit the tree, and then as the car's come to a standstill, she's got out of the car and then collapsed onto the ground at that point. I guess the question for us really is, do we think this is a medical event, or do we think that the car skidded off the road and it's actually traumatic injuries that's then made a collapse?
Oh, it's got bouncy.
That's sort of beneath that.
That is a heavy shower, isn't it? Wow.
The helicopter flies within strict safety parameters. If the weather gets any worse, pilot JB may be forced to turn back.
Okay, we're past this town, and then it's in front of the next town.
I'll have ease there. I've got
Okay,
it.
happy to keep going?
Yeah. Find outside us for overhead steam looking plan.
Yeah, there's the car. Right, there's a gap in the field. You see the gap there, Becky?
Yep.
We're going to land next to that, and that's my plan. Everyone happy with that? If we look now.
Yep.
All clear on the right, all good. That's acknowledged. Continuing forward and down.
That up against the side of a tree.
I've been through a fatal on this tree before.
Oh, have you?
Yeah, we parked just in the farmyard the other side.
Landing on. Tail okay?
Yep, tail looks good, mate.
Coming down.
Fire crews are on the scene, and an off-duty paramedic saw the crash and stopped to help.
Hey, chaps, you alright?
Hello.
So this lady, she's been driving this way between 50 and 60. She's tied in with the tree, self-extricated. We don't really know how she felt before the accident, but she's had this impact.
80-year-old Pauline Franks is dazed. She suffered a collapse at the roadside after dragging herself free from her wrecked car.
Pauline, hiya, I'm Becky. Nice to meet you. Right, I'll look into your chest if that's alright. Any pain when you take a deep breath in?
No, not really.
No, and have you hit your head at all?
No, it's just from there down.
Lovely. Did your airbags come out at all?
Yeah.
So what was the last thing you remembered?
Just spinning round.
Okay, you don't remember anything prior to that?
Just driving along normally. I was watching. I kept away from all the standing water.
Yeah.
Because you see cars splashing through that. No, I kept away from that. and it just, I don't know what happened, it just spun.
Oh, crikey.
Pauline's patchy memory is a red flag for the team. At 50 miles per hour, she spun 360 degrees off the road and hit the tree head on.
The problem is that when the car impacts an object such as a tree that's essentially immovable, the organs in the body continue to move forward at 50, 60 miles an hour, and they will impact on things. So the lungs will hit the front of the ribs, and that can cause significant damage to the lungs. And sometimes the organs within the abdomen, the liver, the spleen, they can be torn away from the blood vessels and cause catastrophic, life-threatening bleeding.
Pauline's granddaughter was in the passenger seat. She appears unhurt, but the car is a write-off.
So just going to have a feel of your tummy?
Yeah.
All right. Any pain out here?
No, it just feels bruised.
It just feels bruised.
I think the worst thing is my arm.
Yeah, just bang the bar arm.
Bruised and the leg.
Yeah.
Okay. Do you feel okay in yourself at the moment? Not dizzy? Not lightheaded?
No.
Pauline appears well, but in addition to the huge impact of the crash, something caused her to lose control at the wheel, and Dr. Paul has serious reservations.
The slight trickiness from our point of view is you've obviously had the car's done a good job, but you've had a real good, you've got into that tree with a fair bump. We're not quite sure what happened in terms of the reason for coming off the road. It might have just been heavy shower and you've slipped off, but what we don't want to miss or not think about is that you've collapsed or blacked out at the wheel. No, okay. The other thing is that, without being rude, you're 80, you've had a real good bump in the car, you've got this big seatbelt mark going right across your chest, and you've got this kind of bruising feeling in your tummy. What we don't want to do is send you home from here, and then in an hour or two you suddenly become much worse because actually you've got a bit of bleeding going off in your tummy that we don't know about. Or do you see what I'm getting at? Nick, our critical care paramedics, had a look at your granddaughter, and again the same with her really. Obviously she's young, but she's been in the same bump, and was she in the front of the car, and that side that she was on is the side that's taken the real impact. Our gut feeling between us is that neither of you have got anything significant or worrying.
Should be more bothered about the thunder.
But yeah, but I find it a bit tricky to send you both home from here until you've had a proper check out in 2 or 3 hours from now in the hospital, really.
The team have called in a ground ambulance to take Pauline to hospital, but the nearest crew are over half an hour away. They could fly, but the weather isn't looking good.
Thunderstorms have lightning, they have updrafts, downdrafts, very, very heavy showers, loads of turbulence, and they're generally a very, very bad thing for helicopters or even any sort of aircraft. I'd much rather be down here wishing I was up there than up there wishing I was down here, and that's definitely the case on a day like today.
With the weather turning, Dr. Paul wants to get his patient to shelter.
Are you going? You watch yourself as well.
Pauline's son-in-law drove straight here when he heard about the crash.
Which way are we going? Going up this way and then along the road, are we?
Yeah, I think so.
Just watch out because this might be a bit slippy on here. Last thing we want, isn't it? You bumped your car and then we...
Oh, look at my car.
Oh, don't worry about that. That's just, you two are fine, which is the main thing. That's just a lump of metal, isn't it? Don't worry about that.
I'm afraid that crew that spotted it has been diverted.
It looks like Pauline skidded on surface water on the road before hitting the tree. There's every chance she has hidden injuries. Dr. Paul doesn't want to risk waiting for a replacement ground ambulance.
It's actually not uncommon that we go to patients who appear well when we first arrive at them, but by the time that we've been on scene for 10-15 minutes, you can see that gradual deterioration over the time, and by the time you arrive at the hospital, actually the patient is significantly more unwell than we first thought when we arrived on the scene. So they're the things that we tend to try and keep an eye out for. We're going to transport the grandmother in the aircraft, and then Nick, the SPCC, has just gone to have a pragmatic chat about family in terms of whether they want to drive in their car and Nick follow them down to Hull. Either way, at least one person's on the way to hospital if we take grandma, and she's more likely to be the poorly one.
Pauline's getting a short flight to the nearest major trauma unit in Hull.
Patient on the aircraft, just over to lift.
Autopilot.
Engaged.
Auto trim.
Engaged.
Risers down and brake.
Helipad out, and we'll go to the right towards the clear air, and then left towards Hull. Lifting into the hover. All good, just come right a little bit. Back, up and back from here.
98 we've lifted route to Hull.
We've decided to fly this lady to hospital. Fortunately, the ambulance services are extremely stretched at the moment. We couldn't stay all day with her on scene, especially with this bruising to her abdomen and the seatbelt mark across the chest in case we're missing any injuries at all. So we've decided to transport her into Hull. So 5-minute flight rather than a 25-minute drive.
Right, it's nicely cut with 3 little pads in it, so turning left now, descending. All looking good, position's good, rate of descent a bit high, but I've got it under control. All good. That'll do, landing on.
98 we landed.
Now they've landed, the shock of the accident is beginning to show on Pauline.
What's your full name, my love?
Pauline.
Your last name as well, Pauline?
Oh God.
She's suddenly confused.
Are you okay?
Yeah.
Are you feeling a bit dazed? A bit sick?
Yeah. It's silly.
Sometimes it happens, you've got a lot on your mind, don't you? Yeah. Alright.
Becky knows it's a sign of a possible head injury. An ambulance will swiftly transfer Pauline to the trauma unit.
Thank you very much.
You're alright, sweetheart.
Thank you.
I hope that ride in the aircraft wasn't so
No,
horrendous.
that's fine, thank you. Thank you.
Pauline is heading for scans to check for hidden injuries. She's been lucky to escape with her life today. When the sun is shining, Yorkshire's rolling hills and dales are a cyclist's dream, with lung-busting climbs for the most hardened riders. But the descents can be just as challenging.
1016, all good.
High above North Yorkshire, the team on board Helimed 98 are heading back to base when dispatcher Kit radios through.
You are off to a 40-year-old man who's come off his bike on a downhill stretch. He's found unconscious by some passers-by. There's a crew 20 minutes away, so you might well be first on scene to this. Yeah, roger mate, thanks.
In the hills at the edge of the Dales National Park, a cyclist is in trouble. Paramedics Andy and Sam will fly there in just under 20 minutes.
I've been called to a 40-year-old male who's come off his cycle going downhill. It's quite a fast road where we're going to, and he's been reported to be unconscious initially. He's conscious now, but he's got some injuries.
The team are heading to the village of Beamsley in Wharfdale. Its arduous, twisting roads are a favourite with cyclists.
Right, well, we're looking for the main road that comes across the moor.
Yeah.
Yeah, there's an ambulance coming up the road.
I can see somebody to the left of the ambulance. It's like a white top.
Yeah, got it. Yeah, he's come down a pretty steep hill by the look of it.
Yeah, isn't it? Let us know now, visual.
Pilot JB is searching for a level landing spot. Not easy in this terrain.
Well, let's go to the field on the other side. There's no cows in it. There's a set of wires, but there is an entrance that we can get in.
A few sheep, they'll start running away.
Yeah, well, clear the wires now.
Yeah. That sheep is off now.
Tail's coming right, that'll do there. Landing on. Cleared out.
Cheers, JB.
Hiya mate, so this is Dan. He's been cycling on his own, he's been coming down here, sort of overshot that, come up, over, we think maybe over his handlebars. His helmet's quite intact, so is much of his bike. Now he thinks he's had an LOC because he thinks he's come and then he's sort of woke up. These lads have come and found him, saying he was a little bit more confused when they arrived. He has got central neck pain. Long bones look good, pelvis, chest nice and clear, no pain apart from a bit of pain up here on his shoulder. So C-spine tenderness with some pain potentially, up here dislocation. So that's about where we've got.
47-year-old talent manager Dan Shorrock was tackling this notoriously steep descent when he lost control. Passing cyclists found him unconscious.
I'd say about 5-10 minutes he started to come round. He was sort of like drifting a little bit, not very with it at all.
Dan, you say that you came down this hill and then you went over the handlebars and everything.
I think so, yeah. Well, I tried to steer out. I realised I'd overcut the corner and then that was it.
Okay. You happy with neurology-wise? Have we got any?
Yeah, he
pins and
seems
needles,
quite
good
lucid
movement?
now. Like I said, these gentlemen said he seemed a little bit more confused, but he seems to have come round more.
Okay.
I think we got it as an unconscious episode, and then obviously more alert, and he seems quite alert to me. Do you know what day it is, Dan?
It's a Friday, isn't it?
Yeah.
Tried to get this ride in nice and early to get back to work.
Dan will now be going to hospital this morning, not work. Beneath the brave face, he may have some worrying injuries.
Have you got pain right in the centre when I pushed there? Does that hurt?
No, not massively.
Not massively, but when you say that, is there some discomfort when I push?
Dan was catapulted 12 feet over the handlebars. The impact to his head could in turn cause injuries to his spine and chest.
I mean, if there's no neurology, we've got good movement, we've got good sensation.
Yeah.
I'm happy if you guys are happy for us to sort of mobilise him from here, with a little bit of support, to the stretcher and immobilise from there.
Yeah.
Well, sorry, what's your name? Michael, if you're happy just supporting his neck for me, just as we sit up. Dan, if it's too painful as we try to sit you up,
We've got to sit above.
just let me know.
Yeah, haven't we?
We'll come at either side of you, Dan, and help you up, okay?
I'll keep hold of your head, okay?
We're going to go nice and gentle.
Dan could collapse again. The team are ready.
Ready, 3, 2, 1. Sit up.
Steady. We're right behind you. Just have a minute. That's it.
Where's that pain, Dan?
Don't move your head, fella. Keep your head still.
Shoulder and sort of across that clavicle there. Okay.
It looks like Dan has painful fractures to his shoulder and collarbone, but Sam's more concerned about his neck pain.
I think, Andy, what we'll do is it's going to be a nightmare to get him onto a scoop here with the ground. So we'll just carry him over to, well, we can walk over to the stretcher and we'll immobilise him onto that.
Yeah, that sounds reasonable, doesn't it?
Rather than rolling Dan onto a stretcher, Sam wants to allow him to self-extricate. It's proven that patients protect any injury they may have without making it worse.
Right. So when you're ready, if you can stand up with us.
Yeah. Grab your shorts.
And if you feel funny, just let us know and we can sit back down nice and easy.
Really grab out because Can I use my hand to...
Yeah, watch those nettles there, you might sting yourself.
Yeah.
Jesus. Steady, steady.
Up we go. Perfect.
You
just grab your bearings there.
Okay. Have a minute, because your blood pressure might just be a little bit weird.
We landed in the hole here, didn't I, boys?
You did.
Good pulse, mate.
Right, Dan, so you're going to go with us, and we're going to go that way.
Thank you.
Okay, nice and steady.
The team will support Dan's neck and head on the tentative walk to the waiting stretcher.
There we go.
I've got C-spine.
They're going to strap into a rigid spinal board.
Do we think we can shuffle? When you bring your legs up, knees up, and just bring your send down a touch. Good lad. Straight down.
Yeah. That's perfect.
We're good?
Yeah.
How are we doing, Dan?
I'm glad to say it's mainly the nettle stings.
Mainly the nettle stings?
So that is what's bothering you more than your shoulder?
Yeah, well, my shoulder is hurting, I've got to be honest.
But the nettles are worse?
Overrides. I've got this sort of burning sensation on my legs and my arms, and then I've got the intermittent pain coming from the shoulder.
Right, so we think that ain't tingling, it's burning. It feels like the nettles, doesn't it?
Yeah.
Have I got any burdock leaves?
The team are joking, but Sam's not convinced Dan's injuries are as mild as they seem. They're taking care to immobilise his neck and spine for the journey to hospital.
Does that hurt?
Yeah, it is sort of more that end.
A little bit.
If I was to isolate it for you.
This is a quiet road in a rural backwater. Dan is lucky he happened to be found by fellow cyclists this morning.
Dan, nice to meet you.
Thank you.
Take care of yourself, alright?
Unfortunate circumstances, but thank you very much.
You're welcome.
The team have done all they can here. Dan's well enough to travel 8 miles to Airedale Hospital by road, freeing up the helicopter for other emergencies.
I've been for some quite nasty injuries with patients down here. He's been, I think, quite lucky today.
While Dan heads off for scans, for the team, it's back to base.
Oh, God, this is ambulance.
Scans in hospital found emergency care assistant Eleanor Whitrod shattered her pelvis and dislocated both hips when the ambulance she was travelling in collided with a car.
I think it probably is a pelvis, isn't it?
The 32-year-old also suffered a broken sternum and several cracked ribs.
Good to go.
Eleanor underwent 4 operations, including plastic surgery to her facial wounds. After a year off work, she still has trouble walking due to nerve damage in her foot. With physiotherapy, it's hoped this will improve over time.
Oh, my leg, my leg, my leg, my leg.
15-year-old Brendan underwent surgery to pin and plate his ankle, which broke when he fell during a game of cricket.
I think my first reaction to it was like, oh my word, what's happened? I tried to stand up on it and it was like, this doesn't feel right. And I looked down, I was like, oh my word, we'll be able to play sport again. And if I'd be able to finish the game, I think was the very first thought. And I was like, maybe not.
I thought, oh, it's just tripped. And then I heard him shout, what's wrong with my leg? I did see the leg initially, but I tried not to look at it because I thought that is horrific. So I was just trying to keep him calm. He was very upset. He was in a lot of pain. It was quite a traumatic day, to be fair.
Oh, my leg's spasming.
Brendan fractured both bones in his lower leg while bowling. His mum was watching the match and stayed by his side.
The worst thing for me was the scream. When they moved his ankle, it took me about 4 days to get over that scream, and I think the lads in the team were in the cricket house, they heard it, and I think it really bothered them, so I felt a bit of a wuss. But then when I heard that they were quite concerned and it got to them a little bit, I didn't feel quite so bad.
Does it hurt anywhere else apart from this ankle?
Saying he wanted to die because he was in so much pain, which was very upsetting. I was so grateful that the air ambulance was coming, really, because at least they were going to get to him a lot faster and give him some pain relief.
Don't give me safe, mate! I'm tripping balls right now, though, sorry!
I remember a couple of things I said, like thinking back and I was like, why did I say that at all? But yeah, I don't remember most of it.
I was trying to be really strong and not get emotional for his sakes, because I'm thinking I don't want to scare him and sort of act like it's majorly serious, this, but knowing in my heart that actually the state of his ankle and where it was, this is quite a very bad injury and it could affect him for the rest of his life.
Brendan spent 3 months recovering and is planning to return to playing competitive sport very soon.
It was quite hard just not doing anything all day. I missed the entire cricket season, I think, so it's a shame. It's just practice, I think, for me. Just keep bowling, get more consistent, and eventually I'll be able to get some wickets down.
So what was the last thing you remembered?
Just spinning round.
80-year-old Pauline Franks was kept in hospital for 2 nights after her car hit surface water and spun off the road into a tree.
I don't know what happened, it just spun.
Oh, it's
Doctors found Pauline had broken her left arm and had severe bruising from the impact.
You've got into that tree with a fair bump.
She's planning to replace her car, which was a write-off, and is taking it easy for now.
I realised I'd overcut the corner and then that was it.
A CT scan in hospital confirmed the paramedics' concerns about cyclist Dan Shorrock. He fractured the lower part of his skull where it joins the neck when he came off his bike in Wharfdale.
We'll come at either side of you, Dan, and help you up, okay?
He also broke his shoulder and collarbone. Dan spent 3 weeks in a neck brace and another 2 months recovering. He's still cycling.